Today, I'm going to talk about how the root cause of chronic fatigue syndrome, or CFS, can originate from a hidden condition in the mouth or in the jawbone or from previous dental procedures and materials. I'm Dr. Maryam Horiyat at Aria Dental, a holistic, biological, integrative dental practice in South Orange County of California. What is chronic fatigue syndrome, or CFS? Chronic fatigue syndrome, or CFS, is also referred to as myalgic encephalomyelitis or systemic exertion intolerance disease, or SEID. CFS is a multi-system disease that causes dysfunction of 1. Neurological system, 2. Immune system, 3. Endocrine system, 4. Energy metabolism system. Chronic fatigue syndrome is a complicated, long-term, debilitating disorder marked by extreme fatigue or tiredness that does not improve with rest and cannot be explained by any medical condition. Chronic fatigue syndrome can affect anyone, including children, although it is more prevalent in women between 30 and 60 years of age. It is estimated that about 2 million Americans have CFS. CFS is highly variable, ranging from relatively normal life all the way to bedridden. CFS also progresses differently in everyone. The symptoms associated with this condition is based on the individual affected and the severity of the condition. Some of the common symptoms are fatigue or extreme exhaustion, loss of memory and concentration or brain fog, enlarged lymph nodes in the armpit or neck, unexplained joint pain and muscle pain, headaches or dizziness, feeling unrefreshed after a night's sleep. What causes CFS? There are some perception that CFS is a psychological illness. However, it is not. It is described as a biological illness because most individuals with CFS have a higher number of inflammatory cytokines and increased number of natural killer cells. The exact cause of condition is unknown. Although many root causes of CFS have been overlooked, experts have suggested that the contributing factors may include: number 1, viral infections such as rubella, Ross River virus, human herpes virus 6, and Epstein-Barr virus, EBV, that causes immunological and neurological dysfunction. Remember, Epstein-Barr virus spreads primarily through saliva. Number 2, bacterial infections such as chlamydia, pneumonia. Number 3, hormonal imbalance. Number 4, mental problems such as emotional trauma, stress, or childhood trauma. Number 5, genetic in some cases is also a factor. The other root causes for CFS that clearly causes dysfunction of immune system, adrenal gland systems, and neurological systems are: number 1, nutrient deficiencies. Number 2, mold and mycotoxins. Number 3, parasites. Number 4, heavy metals. Number 5, toxins, especially neurotoxins. Number 6, microbes like some bacteria. Number 7, sleep disorders such as insomnia and sleep apnea. Let's talk about heavy metals. One of the most toxic heavy metal is mercury. Did you know these amalgam silver fillings contain more than 50% mercury, which constantly released to the mouth during simple chewing and brushing that leads to heavy metal toxicity, which in turn could cause CFS. The other commonly used heavy metal in dentistry are nickel, cobalt, chromium, titanium, and cadmium that can be used in many different types of crowns, such as porcelain fused to metal crown or PFM. These type of crowns, even though you don't see obvious metal alloys on these tooth color crowns, they all have many different metal alloys. In many partial dentures, many different metals, such as cadmium, can be used, which lead to systemic toxification. All titanium dental implants have titanium and other heavy metal alloys. This type of implant corrodes over time, and heavy metal leaks to the jawbone and causes metal toxicity. Release of this toxic heavy metal could be the root cause of CFS in many patients. Now let's talk about toxins like fluoride. Fluoride in dental products, mainly toothpaste, could interfere with many glands, leading to hormonal imbalance. For example, fluoride directly interferes with iodine, leading to thyroid malfunction. As a result of thyroid malfunction, the patient may suffer from chronic fatigue syndrome. Fluoride also negatively affects pineal glands in the brain, which is responsible for productions of melatonin and other hormones that modulate sleep patterns. Therefore, fluoride could cause a sleep disorder in some patients, leading to chronic fatigue syndromes. Now let's talk about microbes and their neurotoxins. Many different bacteria in the mouth could cause periodontitis or gum disease, gingivitis, tooth abscess that could lead to a leaky gum, and activation of pro-inflammatory response, leading to many conditions, including CFS. Hidden jawbone infection or cavitation also cause unexplained medical condition like CFS. In my previous video, I talked more in detail about hidden jawbone infection or cavitation. Hidden jawbone cavitation that occurs mostly around root canal teeth or previous tooth extraction, especially wisdom teeth extraction, act as a breeding ground for not only harmful microorganisms such as bacteria, fungi, or yeast, but also toxins produced from their metabolic waste products that could lead to chronic fatigue syndrome. I personally have witnessed many of our patients that their CFS have resolved and they got back to normal, even the ones that have severe CFS who were bedridden after treatment of their jawbone cavitation. The other reason that could cause chronic fatigue syndrome is airway obstruction, such as sleep apnea, because the patient's body is starving for oxygen during sleep. Narrow palatal arch, high vault or arch hard palate, carotid teeth could be the cause of imprisoning tongue and push it more toward throat, leading to sleep apnea. In adults, we could assist in obstruction by wearing appliances, but in kids, it can be completely treated by proper appliances or orthodontic treatment. My suggestion is to contact your biological and holistic dentist to discuss your oral health to see if your oral health is associated to your chronic fatigue syndrome. I hope you find this video helpful. Please like below and subscribe to our weekly videos about oral health.